going to turn off the record so that if anybody has any questions that they feel comfortable with asking in the group, you'll have the opportunity. So this is super, super exciting. I am so glad that all of you have joined me. When I started putting things out, I thought, I knew that this was an important topic, but you never know until, and the response that I got was so overwhelming that it really showed to me how much this is a topic that we need to discuss, how many questions people have, how many people are really, really dealing with these issues. So today, this is going to be a 3-session boot camp. We're going to do it today and tomorrow at the same time at 8 o'clock, and then again on Wednesday will be the final session. And my goal is for this really to be a place where you will leave this feeling like, okay, I understand this. I understand what the services are. I understand what my resources are. And not only that, but I understand how I can use them, what I need to say, and how I need to activate it and actualize those services. So I really hope that this is what you're going to leave with. And the way I've done this is that I really would like feedback from you either at the end of the session. You can chat, you can send me a chat during the sessions, and I'm gonna make a break at the end of each section for questions. And I want you also that you can also email me during from one day to the next if you want to if you want to be able to ask questions that you don't feel comfortable in the group or not in the chat, etc., or something comes up to you before the next session. So that is fantastic. Okay, so wait, there's a little bit of, I had one slide here, but it doesn't seem to be, but that's okay. As I told you the goals, and I told you that you're going to ask questions and you can ask them in the chat. So before I tell you more about the specifics, I just want you to understand who is talking to you. So for those of you, and I see a lot of new names and faces out there, so those of you who don't know who I am the CEO of an agency called Health Advise. I've been doing this for many years in different forms, working with many different nonprofits. Perhaps you heard of the Shir Pransky Project, which moved over to Yad Lo'alim in some aspect, but I was in charge of creating the whole advocacy package for that program. But I've been heading up Health Advise for the past at least 3 or 4 years in this structure as we were. And I really had the opportunity, me and my staff have had the opportunity to help a lot of people through a whole host of issues, mental health being one of them. But also one of them being, many other issues that people have to deal with in the healthcare system. And just a little bit more about me personally. These are different organizations, by the way, that we've worked with throughout the years. All of these organizations we partner and we do projects with and lectures to, etc. And I'm going to mention these resources, some of them that are here that are resources for you, more specifically later on in session 2 and 3 when they become more relevant. This is a bit more about me. My background, I come to this from a public health background, from a health promotion background. I'm a new Ola. I've been here 25 years. Some days it for sure feels like I'm a new immigrant. In addition to being a professional and dealing with this, all the issues that happen to deal with bureaucracy and healthcare and navigation, I'm also a client, meaning each one of my children has had a different health issue that we've had to navigate. And I'm also the primary caregiver of my mother who has dementia, who lives with me. So I know what it is to be on the other side of the desk. And I really hope today that you're going to get a bit more information about how you can understand the system better, and how you really feel more empowered, because at the end of the day, that's what it really is. It doesn't so matter if you know all the ins and outs, but if you feel empowered to really get the information that you need. Okay, so in order to do that, wait, let me just take a look here at the chat and make sure. Okay, there we go. Okay, excellent. All right, so in order to understand really how the system works, you have to understand the players and all the different people that are sort of all the different organizations, both government and private and nonprofit, who are all working in conjunction within the field of mental health. So you may encounter only one of these groups or these influences along the way. Or it depends how intense your situation is, or if you're helping somebody else navigate the system who has a more severe mental health diagnosis or situation, you might end up dealing with all of these factors, all of these institutions. But I just want to make sure that we're all on the same page here in terms of our terms, because I feel that people sort of throw these things around, and it's important to know who we're talking about. So a therapist is really anybody who is offering any type of therapeutic care. And in the mental health system that we're talking about within the government, those people are psychologists with either a master's or a PhD. We're going to mention that more in a second, or they're a licensed social worker. But within the larger context, and I'll get to that in a second, a therapist is anybody who offers you therapeutic assistance. And there are lots of different types. And it doesn't necessarily mean that this structure is going to recognize them as a therapist, even though they are really much providing you with the help that you need. But in terms of the recognition from the system, it's very different. And that's an important thing to keep in mind. So when we talk about our little the square of who's dealing with our mental health in a formal situation, these are the 4 different components. You've got your therapist, which is a psychologist or the social worker, a psychiatrist, the mental health clinic from the Kupa, and a hospital. Again, it could be that you're not going to see any of those, or it could be that you're going to interact with all of them. Now, we're going to talk in these 3 days about 3 different groups of people. We're going to talk about adults, obviously, who I assume everybody here is attending as an adult. But we also need to focus on different groups that go through the system differently. So one of them are children and teens, and the other one are older adults. So I'm calling them after retirement age adults. Each one of these groups has the need for the mental health system, but their rights and their interactions are going to be different, and we need to make sure that we understand that. So again, we're talking right now only about the formal government infrastructure that who is interacting, who's affecting the group. So for children and teens, the groups that you're going to be interacting with, besides the Kupot Cholim, besides those who offer you healthcare, are going to be Bituach Leumi, which is the national insurance, which is what gives us our disability benefits or rehabilitation benefits, and Misrad HaRevacha and Avodah, or the Ministry of Welfare, Labor, and Social Affairs. Those are specific organizations for children, and when we're talking about adults, we're exchanging Ministry of Welfare for the Ministry of Health, or Misrad HaBriut, and that's important to note, and we're going to talk about that again a little bit later on, but we're going to hold this thought in our heads. Also, I didn't clarify it at the end, but I don't want anybody, this could be very overwhelming to people, or it can be a repeat of things that you already know, but I've put together a 20-page, very comprehensive guide that I'm going to send to you in PDF form at the end of this boot camp, with everything that I've talked about, including links to all the Kupot and the English-speaking providers that they have, and all the resources with phone numbers, and all of this information distilled in a format that you can really absorb. So this is just, for you to get out there. Now, some of you are here today because you said, I just want a therapist. I'm either suffering from a diagnosis that I know that I have. For example, I know that I suffer from depression and but I need to work it out, or I'm going through a really traumatic divorce or another traumatic experience, or hey, I don't know, Corona and life since the pandemic, has really been challenging. So there are many ways to receive this help. Some are completely private, as we see here, like somatic experience therapists, which a lot of people use this. There is I know that a lot of people also choose to use sacral cranial therapy. I've heard that a lot of times for anxiety. So those are the people that are considered therapists. But not everyone is going to have the ability to either get paid for by the Kupa or even be subsidized by the Kupa. So that's an important thing to note. And you can choose whatever therapy you want if your wallet allows it. Another important point I just want to mention here, because I hear these terms interchanged all the time, and it's really, really crucial that we understand the difference. Because a psychiatrist, which is the definition on the bottom of my slide, is a doctor, is a medical doctor who has a degree, who's done a residency in psychiatry, and either may work through the Kupa or work in the mental health clinic or work in the hospital or work privately. That part is less important. However, they are the only ones who can prescribe medication. And they are the only ones who you can get subsidized to see, like another medical specialist in the Kupa. So that is very important. However, in Israel, it is very uncommon to find a psychiatrist who will offer therapy in the kind that we might be familiar with if we come from, let's say, from North America, in that talk therapy or even CBT or DBT or any type of a therapeutic environment on an ongoing basis. That you mostly don't see in this country. You see psychologists, licensed psychologists, or a licensed social worker who are offering those therapies, and the psychiatrists are offering medication, and they are following up with somebody who is taking any type of psychiatric medication on a 3 to 6 month basis. So that is important to note the distinction. Now, I put together a very nice flow chart here of everything, and I'm sure that everybody is like a little bit confused, like, huh? And that was exactly my point, is that when we enter into the system, we feel, we can feel extremely overwhelmed. What are my resources? Where do I go? And what is happening? So I put every group together here so you can kind of see all the different people that are interacting with the person who is suffering, and it's really suffering from a mental health diagnosis. And you can see that you're interacting with a number of different groups at the same time. And here is where the clincher is that you need to know what groups are you interacting with and when and how. What kind of information are you going to provide for them? So let's start with the basic model. Okay, I am an adult who is suffering from some type of mental illness, and it could be, we're talking about, a whole range here. These are all of my options. As I said before, you can choose a private therapist, which you pay for by yourself completely privately. You can find the person through any number of ways, and I have a chart on that in the guide. But you can find them through a lot of people find through crowdsourcing. You can find them through asking a friend. You can find through a lot of Facebook groups. There's now WhatsApp groups. Those are all reasonable ways to identify a private therapist, and those are fine ways. We shouldn't look down on those ways, because recommendations are the best way often to get information. We just have to be very specific as much as we can about what we're looking for, and to know that that is a private therapist, that is not going to be subsidized in any way, and the cost can range anywhere from 350 shekels to 800 900, 1,000 shekels per visit, depending on who the practitioner is. And we just need to know that from the get-go. Number two is a kupa psychologist, which is subsidized. And again, in your guide, I break down to tell you exactly how much, what is the cost of the kupa psychologist. And that is because the government, of which guarantees basket of services for all of its citizens, gave over the field of mental health finally, after a 15-year, as it were, I don't know, practice or, working things out, but finally gave over the mental health area to the Kupat Cholim. So the Kupat Cholim is in charge of delivering mental health services, and they can do that in several ways. One of them, and I think the most common way, is to subcontract with private licensed psychologists. And I'll mention that in a more, why do I say only licensed psychologists? They have a special contract with a group, with individuals who then offer this therapy at a subsidized rate, which is around 150 shekels per time, other than 60 shekels, which is the assessment. So that means that you can get subsidized therapy through a certain type of therapist through the kupa. Now, the most important thing you have to understand is it's through the kupa, meaning you can't see somebody and then expect the kupa to reimburse you for somebody that you saw. You have to go with the list of the kupa that the kupa gives you. And I have the tables, I have the links and the information in the guide, because each year it changes, because each year there's a different grouping. Some people leave, some people join the kupa. And it's very individual, and it also very much depends on your geographic area, how many people you will have to choose from. For example, in Maccabi, as of right in the middle of the pandemic, they had exactly one English speaker identified in Beit Shemesh who could offer therapy through the kupa. It is an issue. I will in no way argue with that. I have been to the Knesset several times. I have spoken to many people higher up in the kupa and explained to them the need for English-speaking therapists subsidized through the kupa. On our day 3, I'm going to talk to you about some really nice new options that aren't through the kupa, that are subsidized, at least in some areas, and that are offering English-speaking therapy. So that could be another option. But for now, that is where we are. That means, and yes, this is very true, that you have to go through the list. It's not like a doctor where you go online and you make an appointment. You have to go through the list and call each provider. And if they have time, they will let you know. And if not, then you have to move on to the next provider. It is not a perfect model, but that is currently how things are working now. The other option that you have, number 3, is the mental health clinic, which is really more for people who are either were hospitalized and now they're back, they've been discharged, they had a psychiatric hospitalization, and now they're back in the community, and they need to really get themselves reestablished and they need more ongoing support. Or somebody who has a mental health diagnosis like schizophrenia or bipolar that's regulated with medication. Those are the people who are most suitable to mental health clinic, because not only do they have a therapist, but they also have a psychiatrist and a social worker who can handle some of the bureaucratic issues, as well as a secretary who's there for a lot of the paperwork and organization. Every kupa in their geographic area has a mental health clinic, and you can look it up on the website. It's called Mirpa'a Lebriut HaNefesh. Now, it really depends where you live in terms of what clinics are available to you. Some kupot, for example, Meuchedet in Yerushalayim, has its own clinic. It's a Meuchedet office. It is located in Binyan Klal, in Binyan Kich, on the 3rd floor, and it is Meuchedet. However, there are other areas of the city, for example, in Talpiot, where Meuchedet, if we're talking about Jerusalem, also outsources to a amuta, nonprofit that runs a clinic, and they work with the Kupat Cholim. So every geographic area is very different, and you need to be able to look up on the website to figure out where's your specific mental health clinic if you want to pursue that. And we're going to talk about that probably on day 3 in terms of if you want to identify that clinic. Okay, number 4, the emergency room. There are specific emergency rooms that are designated for psychiatric admittance, and I highly recommend people, if you need to bring somebody to the emergency room because they feel, and here's the clincher, that they are a danger to themselves or to others, that is really the only time that one can use this acute service, if they are a danger to themselves and others. And also in the guide, I've included the list of emergency rooms because that's really what you want to go to. Remember, if you're going to some place and you don't know if they have a psychiatric unit or not, and you might be billed for the emergency room visit if you don't have a referral. So that's an important thing to note. Now, I get asked a lot about the issue of mandatory hospitalization. Especially people who call if they're worried about a loved one who they feel is not taking care of themselves or not balanced or having a break from reality, which is an extremely painful thing to see and to watch somebody else go through. However, it is not so easy to actually, even though you hear lots of stories, but it isn't actually so easy to mandate somebody to do to be under a psychiatric hospitalization unless the police get involved. Once the police are involved and they put a request in, they see that it's a psychiatric situation, then it's almost always going to be a mandatory hospitalization. Unless the person is completely harmless, then it was an issue of more of wandering or loitering than it was of disruption. Number 7, we're going to also mention that a little bit more in depth tomorrow, but for those adults who have a significant mental health diagnosis that prevents them from really working full-time or contributing to the work environment in a significant way, and they need more assistance, the Ministry of Health has a package that offers people the ability to have more integration with the community, which is really actually an amazing resource. As in all of the resources that are provided by the government, and I want to make this very clear, they are amazing resources. They really are. I think that we have a lot of strengths in this healthcare system in Israel. However, there is no system that runs itself. So for any of you who've tried to make an appointment with a therapist already, or any of you who've even, tried to go to the pharmacy and get a medication that they said was, was not currently not available, and you could go to other pharmacies, or you could wait, or you could try something else, or etc. You know that you have to advocate for yourself, meaning that you need to be able to, you need to be able to push for things that you need, and that is always true. And also Sal Shikum and is exactly the same. Sorry, it's exactly the same as other anything small to anything big. And the final is the private psychiatrist, and I mentioned the difference between psychologist and psychiatrist beforehand. And the private psychiatrist is anywhere from 600 to 1,200 shekels, where you see somebody. It's usually when you are looking for a diagnosis, when you have a complex situation, or you've been to other providers, or is something completely new with an adult who never had a history of mental health diagnosis, and suddenly something has come up. So that is often when you seek out a private psychiatrist, A, because it's much faster to get an appointment, B, because they have more time, and C, often because they have a bit more experience in these particular areas that you need more of a comprehensive diagnosis. So that is an adult who is suffering. I'm just going to take a break here and see if there are any question. Nope. Okay, we're just talking about renaming yourself. All good. Okay. Okay. So now we are going to go on to something that's very similar, and I know the reason that a bunch of you also wanted to come here is what happens when there is a child suffering from a mental health diagnosis. And from here, I'm saying child as both, you know, I'm going to break it down a little bit more later on, but also a child and also a teenager. So anybody who is under 18 who is been diagnosed with a or is, it doesn't even have to be diagnosed, but is suffering. So option 1 and 2 are the same as I mentioned with the adults, and I won't review that again. But option 3 is a child who is under age 6 who is exhibiting severe either behavioral issues or communication issues or social adjustment issues that are significant enough that that the parent is noticing, or the ganenet, the kindergarten teacher is noticing, or another professional is noticing, then the answer here is, the address is to go to what they call the Mechon or Merkaz להתפתחות הילד, or the developmental clinic, which is till age 6. So that is where those diagnoses are done, and that is through the Kupat Cholim, and you must get a referral from a pediatrician, so from your pediatrician, with usually information from another source saying that this analysis is warranted. Number 4 and number 5, number 6 are all the same as with an adult. However, obviously they're a minor, so they need to be with an adult. And interestingly enough, but after age 15 in this country, you're not really eligible for information about your child. So sometimes the system will interact with the parent because they obviously know that they're the guardian of this child, and will provide information and will have a back and forth. But sometimes they will, you know, be, let's say, I don't know, pedantic about the law, and they won't share information. So that is something important to understand. Number 7 is interesting because a lot of people don't see this, but if you have a child who has any kind of, and I'm mentioning this in part, let's say on the autistic spectrum, what they call ASD, which is not really a mental health diagnosis, but it's sort of, and nobody really knows how to categorize it, so that's why I'm putting it in here, along with other behavioral diagnoses that, again, we might not even classify as mental health, but they kind of get lumped in there, is that until a certain point, the Ministry of Education is actually the one who's delivering auxiliary services to make sure that the child's needs are met within the classroom. So that can be what they call a kita ktana, a small class. That can be called with a sayat or an assistant who accompanies the child in a regular class. They are given special hours, whether they be therapy hours or occupational therapy hours or physical or speech. Those are all part of it. And it can be purely for a child who has what we call the sort of amorphous mental health diagnosis. So that's important to note, that that is a very big resource and a very important person to bring in when there is a child who is suffering. And the last one is what I mentioned at the beginning. Another group that is involved with mental health care in Israel is Misrad HaRevacha, the Ministry of Welfare. And some of you may be familiar with something called Chok LeNoal, which is the Youth at Risk law, which is a wide it's a wide category to encompass any child who they think is at risk, either because of a family situation, either because of a behavioral situation, or because of a mental health issue that isn't severe enough They're still part of society, but they feel that the Ministry of Welfare decides that the family and therefore the child need more intervention. Now, it's not a process that happens overnight, and it is often a process that happens in a back or forth with the school. But just to know that if the school feels that there is an issue, they have a mandate to report it to the Ministry of Welfare. Okay, so it shouldn't be, you shouldn't say, you know, why are they involved in my life, which I know happens sometimes to parents, but it is not the fault of the school, or it is a system that is set up to offer another support system to the child and parent. And again, it is just one of the many institutions that you need to figure out that cooperation, that back and forth, so at the end of the day, meet the needs of your child. Okay, how do you get into a Kupat Cholim mental clinic for an adult? Thank you, excellent question. And this is one of the issues that really, when you need to think about who is your case manager. So if you are doing it for yourself, it is obviously a bit more challenging because you are the one who is suffering and you often don't have the strength, energy, mindset to be able to do this. You basically, if you have a discharge, if you are coming from a psychiatric discharge situation, then it is easier to facilitate that because the hospital is obligated to make sure that you have plans in the community for your care. And they are actually legally not allowed to discharge somebody without A, meeting with the doctor within 5 days of admittance. Again, I have that written down in the guides. You don't have to remember the details, but it's important to note that. B, having a conversation with the doctor about the treatment plan. And C, making sure that there is a place to land in the community, which means that the secretary / social worker / nurse of the psychiatric unit has the mandate to make contact with the mental health clinic in the community and make sure that you have an appointment within a reasonable period of time after discharge. Now, I have had this conversation many times with the Ministry of Health, as well as with people in the hospital, because they insist to me, and you will see the numbers from the Ministry of Health that say 85–90% of the time this happens. And I will say that I have been working in this field for over 15 years. At this point, I can't even tens, dozens, almost 100 clients that I've worked with through the mental health care system. And I can really count on one hand where that's happened without any initiation on the part of the patient's family or somebody from outside their circle, like an advocate. So there's a bit of a discrepancy as to whether or not that happens, but I am telling you that that is what is supposed to happen, and legally that is what is mandated to happen. Now, if you are not coming from a psychiatric discharge, but you have a significant mental health diagnosis, and again, I mentioned something like schizophrenia or bipolar, something that warrants, I'm not talking about, not to minimize, but I'm just trying to differentiate, not depression, clinical depression, unless you are completely unable to function in any sense of daily living. So that if it's severe enough where your daily functioning is almost completely minimized and you really need to see somebody twice a week and you really need that more support system, then you get a referral from your family doctor who submits forms to the Kupa. In Maccabi, actually, you can do it now by yourself online. In Mu'chadet, it's through the family doctor. You submit them, and then they contact you, and they make an appointment for you. I will also tell you that since COVID, especially in the larger metropolitan areas, like in the Jerusalem area, Also some places up north, there is a serious backlog, unfortunately. But that is the way to get a referral and to make an appointment with the mental health clinic. Let me just make sure. Okay, Ishpuz Yom options for adults. That is for after there is discharge, and that is called after there's the discharge from the hospital, and that is called the treatment plan. We're going to go into that a little bit later, probably tomorrow, when we talk more about the specifics, of that, because that's also related to Sal Shikun. So hold the thought, I will get into that. And Clalit, how do they do it? It's also a referral through the family doctor through to the mental health clinic. Okie dokie. Okay, now we're going to move on to one more thing about somebody who is over retirement age. And this is where it gets tricky, because as we age, there are certain things that develop that either stem from an existing mental health diagnosis, or it's actually another illness that is coming out as a mental health diagnosis, but is in fact not. You see that often in people who develop Alzheimer's. Either they become extremely depressed, or they become extremely combative with serious disruptive behavior, and they're mistakenly diagnosed sometimes with bipolar disorder. So it's a bit of a tricky area, especially for somebody, child of or friend of, who's trying to help their friend or family member. So number 1 through 6 stays the same as it does in the other groups. But there is an additional resource here for people. Is most of the kupot and most of the geographic areas, not all, but most, have what they're now calling either Mirpaat Geriatri, or they're calling them Mirpaat Zikaron, like a memory center. It depends, which area, but that's where they're going to do a more comprehensive assessment. So that's when you're going to talk to a psychiatrist, sometimes a geriatrician, a social worker, a nurse, an occupational therapist, a physical therapist. Again, this is generally not in every geographic area do you have them, but I strongly encourage you to have one, to pursue that. And often that can help you determine whether or not this is a psychiatric issue that we're dealing with, or if this is more of a disease oriented or an age-related illness, which also can determine how it's going to be treated. For those people who are here with no family, and those people who are often living on a smaller budget, for example, people who are living only on their Social Security, there is a department in the Ministry of Welfare specifically for seniors. They call it Vatikim. In Jerusalem, there's even a pilot program that is working together with the Iriya for a more comprehensive support of this population of people. But this is something to check out in your specific municipality, because every municipality has this office. And sometimes there is a social worker who can actually offer therapy and or support, in terms of, is it's making appointments, if it's understanding the system, if it's applying for benefits, if it's receiving aid. Sometimes there are grants that can be given, but also for just talking to. So this is an additional resources for people over retirement age who maybe in the past, or maybe they continue, maybe their whole life they've suffered from a mental health diagnosis, and now it's gotten worse, or they need additional resources. So those are options. Okay, so I don't want to overwhelm you. I'm sure for some of you this is like old hat, you know this. For others of you, you're like, what? So right now, I just want to give you an opportunity to take a moment and write in the chat if there's something that I haven't clarified for you. You can either write it to everyone, you can also just write it to me. First of all, so there are questions about what I said. Second, are there pockets within what I've said that you really feel that you would like to go more in depth with, which we can, if we have time now, or if not tomorrow, and specific issues like for tomorrow and the next day that you'd like to talk about. So just to give you, while you're doing that, a bit of an overview about tomorrow, we're going to go more into depth about rights. Now that you understand who the different players are and what the different systems are that are operating, we're going to talk about more specifics about our rights. What do we need to know? Some tips and tricks that are important to understand about the system that can help you move things forward. And the third day is really going to be dedicated to resources. I want to make sure that you know all of the existing resources and that you can take advantage of them, whether that be nonprofit organizations or within the system itself. Where are places that you can go to try to get the help, or try to create more of a support system for you or the person that you're caring for. So those are going to be the goals for the next 2 days. And let's take a look here. Okie dokie. Okay, so I mentioned, how do you get into a Kupat mental health clinic? I think I mentioned, are these options available for Anglos? Everything that I've said now applies to people who are English speakers. Now, and everybody's entitled to the same rights. You are correct if you are thinking, I've called, there's nobody there who speaks English. So if you were looking specifically for a psychologist subsidized through the Kupa, sort of your more run-of-the-mill, I just want to pay that 150 shekels to somebody, and I want them to be able to speak English. So you should know, first of all, I did the work for you. I actually did the work for you, and I went through and I called out everybody who says that they spoke English, and I'll send you the guide, and you can see in your area who they say is an English speaker who can provide for you through the Kupa. However, if you have gone through many years of education, there is an assumption that you speak English, no matter where you learned or no matter how old you are. And unfortunately, this is not always the case. So even though the administration of the Kupa will say, okay, this person says that they speak English, and true story, spoke to somebody who said she spoke English, and then when we further talked to her, she said, well, I can go food shopping in America. Which I explained that that's great that you go food shopping in America, but if you can't actually offer therapy in English, then I don't think that you can say that you speak English. So just because somebody writes it down doesn't necessarily mean that they will be able to provide therapy, but in a theoretical level, that is an option that is available. And I will say this now, but I'll also mention it again, that you as an English speaker have the ability to influence, by communicating with your Kupa, the need for more contracted English speakers. And there's a way to do that. I will send you, I will show you the link on the resource day and the last day, and you can contact the Kupa and you can push. And I think that personally, I've lived in this country for 25 years. And up until 10 years, well, before Nefesh B'Nefesh, things were completely different. And even in the past 10 years, like if you had even mentioned anything about an English lobby, etc., people would have looked at you funny. But there are powers in numbers, and there are more English speakers moving here. And I think the more people that push for these things, then the higher chance we have of actually seeing change. Okay. Those apps. What about the Tachana Briut that are not Kupa run in Jerusalem? I know, right. So that's what I wanted, and I'm sorry if I didn't explain that well, is before 2017, you were having the Ministry of Health, which was responsible for healthcare, and you had these mental health clinics that were nonprofits that were providing this type of care for the Misrad Briut. In 2017, they finally got their act together, or not, depending on who you ask, and they said, okay, the Kupa is in charge, and they basically divvied up these different clinics that beforehand were only working with the Misrad Briut, and they divvied them up under the auspices of specific Kupot. So, for example, the one that's on Shalom Yehuda, I think it's Beit Cham, in Talpiot, which used to be a nonprofit working for Misrad Briut, is now under Me'uchedet. So they still kept their maybe their outlook and probably and their management, but they are supposedly supervised by and utilized by Mujeres. So that's important. There aren't any more, for the most part, in this particular area. All of those kupot, I mean, all of those clinics are actually under the auspices of a kupa. And you need to look at the kupa website to find, I'm going to show you how to do that tomorrow, to find out exactly which centers are under your kupa. Okay, yes. Sal Shikum, what is an adult and how does one already apply? Yes, I am going to talk about Sal Shikum tomorrow. I have like a whole sheet and it's going to be in your guide and I'm going to love it. So if you hold on and come tomorrow, you will get more than you ever wanted to know about Sal Shikum. Okay, what is the process to set up therapists through the Kupa? As I mentioned, it's looking at the list of contracted therapists that the Kupa list. And again, I've done the work for you. So tomorrow I'm going to give you the guide. You come tomorrow, you do the guide, and you'll get the link, and you'll have the whole chart in front of you, and you can see exactly in your area who your Kupa is contracting with this year. And you can call them. And do not be misled. You do not need a referral to do this. You call the provider directly, the therapist directly. You don't need a referral from your doctor, and you don't need a referral from anybody else. Okay. Okay. I'm glad. I hope that, I know that some of you I've met with you in the past, and I know you're going through some challenging times, some of you. And I would very much like to help each one of you individually. So feel free to reach out through the email after this with your specific question, or your specific, not even a question, your specific incidents or issue, and we'll see if we can help you very specifically. Okay. Okay, tomorrow, right. Yes. Oh, this is a fantastic question. Someone who is eligible for disability before turning age 67. Yes, thought it was drop throat. This is a fascinating question. I won't go into the specifics now, but suffice it to say, if you made Aliyah after a certain age, let's see, if you were a man and you made Aliyah, I think at age 60, but you then hit age 67, you actually may lose your disability status and you will not get the extra payment going into retirement. It is a, I don't know if you want to call it loophole, mistake, problem, oversight in the Bituach Leumi system. I have several clients who this is happening to. I looked into launching a bit of a class action suit, as it were. It's a work in progress, but whoever reached out to me, if you could send me a specific email about that, and I will send you the details about what is happening now in that particular issue. And it was not changed, so it's concerned. Okay, so yes, so a child who has diagnosis, but now Misrad HaChinuch will not consider. So they are supposed to, first of all, now they've made a decision that you don't have to keep going back to the Vada. Once you have the recognition of your status in Misrad HaChinuch, it's supposed to continue. If you, first of all, now is the time, anyway, now is the time that the Vadot are happening. So now is the time to give in the information if you didn't have it before. And yes, you can always also push for what they call Vadat Chaligim, an exception. But for sure, now is the time. It's November, and Vadat Chaligim sometimes aren't even until May. So now is the time to push Misrad HaChinuch and say, here's my child, here's the diagnosis. We would like a committee, we would like a Vada. Next question. There's no therapy option that is fully covered by the Kupa, 100%. If you go to a mental health clinic, because you are eligible, as I spoke, for the severe diagnosis, then yes, you only have to pay 33 shekels per quarter, as you were for physical therapy or someone else. So that is the most fully covered. Or if you're hospitalized, that's also fully covered. If you were looking for individual one-on-one therapy, then you need to pay the subsidized copay. Support patient available to bipolar patients. We're going to go more into that. Patients with bipolar disorder. We're going to talk more about Sal Shikum and Bituach Leumi tomorrow. Excellent question. Can you renew medications with a private psychiatrist via your family doctor? So there are certain medications that if you got a private prescription, like the SSRIs, it used to be that it was only through a psychiatrist. Now the family doctor can prescribe for you. But it certain depends what the medication is and if you want the subsidy. So for example, if you, Seroquel, for example, if you get it prescribed through the family doctor and not the psychiatrist, through the Coupa, not a private psychiatrist, because the Coupa doctor needs to give you the prescriptions, then you will be, then you either will have to pay the full amount, or in some cases they can't write the prescription itself. So it really depends on the medication. And that's something that you can check on ahead of time, and I'll show you the website where you can look at the medication. And you can also email me. Some people email me those questions all the time. Yes. So what if you can't find an English-speaking therapist and you can't afford to go private? This is the conundrum, and we are all suffering from this issue. You are absolutely, absolutely correct. I recommend that you go a bit further afield. If you have a car, you look at geographic areas that are not just in your city, but that you look outside. And I also recommend online therapy. There are some very good, not so expensive online therapies that are offered in English by English-speaking providers because they're online and they've had good success. They can be less expensive. Again, I'm going to mention those resources on day 3. Okay, and I got time for one more question about ADHD assessment. Thank you for mentioning this. Does the Coupa cover this? And it really depends what it is that the diagnosis is going to be. So if you're going to have the more typical diagnosis, which would be through a neurologist who's doing more of an analysis of the paperwork and talking to the child, or a psychiatrist, that is covered by the Coupa. If you're doing something called the MOXO test or the TOVA, or they don't do that so much anymore, but the MOXO, which is really a test where the child does exercises on the screen, then takes the medication like Ritalin, and then does the exercises again, those are also covered. If you want a more comprehensive diagnosis, what's called the psychodidactic, which looks at a bunch of parameters, also emotional, also learning. The Coupa now, it used to not be, but in the past 5 years, they have added that if you have supplemental Coupa Trolim, they will offer you you can do it one time in the child's academic career. So anytime through 1st to 12th grade, you can get it discounted on that anywhere between 500 and 800 shekels, depending on your Coupa and the location. So that is the summary for ADD. My pleasure. Wow, I think that I went a little bit, oh no, look at that, perfect timing, excellent. Okay, so everybody knows, I hope that it's the same link for tomorrow. And tomorrow we're gonna do I'm gonna give you the guide, oops, sorry. I'm gonna give you the guide, and that's gonna have lots of information on it. And then day 3, if you stay with me, we're gonna do a raffle. It's gonna be very exciting. Noah's gonna help us. Noah's my office manager. She's here, and we're gonna do a raffle for all of those who attend to see who's gonna win an hour-long consult session with me, where we can do anything that you want, including applying for benefits, reviewing your medical information, making a plan of attack, whatever. So I do hope that you join me. I'm really glad, and please feel free to email us at info@healthadvise. Before tomorrow with any questions. Take a look at the website. I've got tons of information there, all sorts about mental health care navigation, and Facebook, as always, got some interesting posts and a lot of YouTube videos to explain various aspects of navigating the medical system in general, which obviously we're not covering in this session. So I'm going to say adieu. It was lovely having you all. Really excited to see you tomorrow. You join us, doors open at 7:50, and we'll start at 8 o'clock. So thank you all. Bye.